Thank you. Thank you very much, Wyatt. Hey, tonight here on ABC2, we are talking about breast cancer, and we want to talk to you and answer your questions. We have a team of professionals over there in Studio B from MedStar Health, and they're taking your calls. ABC2's Ashley James is in our studio right now with some very important information to share with all of us. Ashley?
Yeah, Jamie, we're very fortunate to have the experts in our studio this evening answering all of our questions about breast health. So I want to start with Dr. Masa Mohebtesh. She is the Chief of Medical Oncology at MedStar Union Memorial Hospital. So thank you so much for joining us this evening.
Thank you for having me.
No problem. Well, I want to start with asking you, what are the key factors that put someone at risk for breast cancer?
So increasing age and female gender is well-established risk factors for breast cancer. Ethnicity and race play a role, like breast cancer is slightly more common in white race. Having said that, still breast cancer is the most common cancer in women across all ethnicities. In women who have gone through menopause, obesity can be associated with higher risk of breast cancer. There are some genetic factors there, like if you have family history of breast cancer, you're at higher risk, especially in first-degree relatives. So I highly recommend genetic counseling if somebody has a family history of breast cancer to see that if there is any need for, genetic testing or something like that. Long-term use of hormonal replacement for menopausal symptoms is another risk factor. There are other risk factors, but not all of them are well established. But these are among the key risk factors.
Well, doctor, is there something that we can do as women to lower the risk for breast cancer?
So some risk factors are not modifiable. Like if you have family history of breast cancer, you cannot do anything about it. Of course, you can be more vigilant, but there are certain risk factors that you can modify, like limiting the alcohol intake. There is proof that you can lower your risk of breast cancer with that. If you avoid long-term use of hormone replacement therapy, it's another risk factor. Breastfeeding has been proven to have protective effect against breast cancer, so does physical activity. So these are life modifications, that you can do to lower your risk. But, there are some risk factors that you cannot do much about.
And we're almost out of time, but I do want to ask you, what can women do to detect breast cancer?
The most important thing is regular annual mammograms starting at age 40.
At age 40.
Right. Breast exam by physicians are recommended by most experts on guidelines, but there are some discrepancies, but mammograms are number one.
Doctor, thank you so much for great information. We really appreciate it. Jamie, back to you.
All right, Ashley, get back to that phone bank. Doctor, thank you. A trip to D.C.